Good evening, brother and sister in Venture Sealing Ministry. Good evening. So we are going to continue with our tonight's talk. That is talking about endocrine disorder also. Okay, but we continue with part 3. It's related to thyroid problems and common women's diseases. Okay, so endocrine disorder will cause thyroid problems, is what we know, and then this a common illness. Most of the women they might experience, and it bring her a lot of disturbance, and then sometimes it this emotional, it will affected her seriously by hyperthyroidism also. So what is thyroid? Okay, thyroid is basically a gland located at the neck. Okay, and then it control a lot of activity on metabolism of the bodies. So actually, there are quite number of diseases related to this thyroid gland. For example, diseases that is caused by self-immune attack, like this what we call the Hashimoto diseases, whereby the immune system attack our thyroid and cause hypothyroidism. That means the release of this hormone in the thyroid getting very less. And then, however, there are the other types we call the Graves disease, which are also okay related to immune disorder, and the attack make the thyroid to really become very excited and then release too much of thyroid hormone, so it will come out as a symptom of hyperthyroidism. Okay, so beside that, there might be normal sometimes inflammation happen to the thyroid and cause either hypothyroidism or hyperthyroidism. So it's basically very important for us to identify if we talk about thyroid dysfunction. Either you are having what we call the hyper or hypothyroidism. Okay, so they are totally two different condition, and then the symptoms that appear will be quite obvious, and then there are difference. But normally when you experience a thyroid problem, then doctor will diagnose and let you know which type of thyroidism that you are having. And it's very necessary because the step you are going to take, okay, to treat okay the hypo this thyroidism, either is hypo or hyper, is totally different. Okay, so we for those who didn't go for a doctor checking, okay, or diagnosed by any doctor on the problem of thyroid, but they suspect they are having thyroid problem, they can refer okay to the symptoms of different types of thyroid, so that you can decide you and know that you are actually in what condition. So we concentrate on hypothyroidism first. The symptoms are after having hypothyroidism, that means the release of hormones on thyroid will get lesser, and then it will affect the metabolism of the body. Metabolic will get lesser, slower, and then finally it affect uh, to have all these dry coarse hair, and then loss of eyebrow hair, and maybe she will have a buffy face. Retention of water is slightly higher, especially on the face part, and enlarge this thyroid, what we call the goiter. So the goiter, most of the people would thought that those people who are having hypothyroidism may have this problem. It means the enlarge of the thyroid. But however, this is not the only what we call symptoms that we are looking, because sometimes the hyperthyroidism may have enlarged thyroid also, so we cannot decide, okay, by using these symptoms. Okay, goiter, that means inflammation may happen in the thyroid there, and then it will cause either hypo and hyperthyroidism. Okay, so okay, we see on hypothyroidism, maybe you experience slow heartbeat, okay, because of the metabolic is going down. The heartbeat also will be affected, and then the beating will be very slow. So the common beating of an average people will be something like 70 to 80 something. Okay, if you are having hypothyroidism, maybe your heartbeat will be slower, or maybe 60 something, sometimes maybe lower than 60, and then it makes the blood circulation in the body sometimes maybe slower too. Okay, and then you might experience cold this intolerance. That means when you are in the aircon room, sometimes you cannot stand the cold, or you have to wear a sweater or something like that. Okay, to and then emotionally you become the brain sometimes is not that active. Okay, and then you might experience emotionally depression. And then what we call the dry skin okay, will happen. And then normally because of low metabolic, you will face fatigue, okay, easily will get tired very fast. And then brain forgetfulness will happen, because the brain is not that strong in terms of activity. Okay, and then your period cycle, you might experience heavy menstrual period. That means your period will be volume will be very high, and then it will drag maybe the time will be very long. Okay, that is what we describe about heavy menstrual period. Okay, and then infertility, very difficult to get pregnant. And then what we call the muscle, okay, all on the body you might face a muscle ache, okay, painful on the muscle. And finally you will gain weight, okay, so you get fat. For those who are having hyperthyroidism, it means the release of thyroid hormone will get higher in the body, and then the metabolic of the body will get higher too. Okay, so eventually it will affect her and giving her the symptoms of hair loss, and then bulging eyes. Okay, that means the eyes is like coming out okay, and then sweating, okay, without reason. Okay, you get sweating very fast. Or then enlarged thyroid glands, okay, on the goiter also. And then he might experience a heartbeat getting very fast. A fast heartbeat is the symptoms of hyperthyroidism. Difficult to sleep because of this. It will actually affect her a lot on the emotional control, getting her anger very fast. And then very difficult to sleep, okay, anxiety, okay, and then sometimes a heat intolerance will happen. Okay, that means a little bit increase in the temperature, you get sweating very fast, or there is called the heat intolerance. Then very difficult to get pregnant also, infertility might happen. And then the muscle will experience like no strength, okay, the weakness of the muscle. And then what we call the brain is too active, sometimes forgiveness forgive what we call the nervousness might happen. Okay, you feel tension, nervous, anxiety anger, okay, easily will happen. And then what we call your menstrual period will getting very short, and then the volume might be very low. Okay, what we call the scan period cycle. And You might experience a weight loss seriously or in a very within a very short period. Okay, again, and then lastly, the bowel movement will be more frequent because of the instability of the colon. Okay, the colon too much of activity is happening, and then the bowel movement will get more frequent. So these are the symptoms of hyperthyroidism. So let's us have a look on the common causes of thyroid problems. Just now we have already mentioned thyroid problem caused by immune system cell attack. There are Hashimoto diseases and Graves diseases. Okay, one is hypo and then the other one is hyper. Okay, and then beside that, okay, some of the thyroid problem they might happen because of nutrient problems. There is the iodine deficiency in the body or excessive iodine intake in the body. For those who like to take a lot of seafood, okay, they might experience hyperthyroidism easily because excessive of iodine. Okay, so for those who didn't consume enough okay iodine, they might have a hypothyroidism. Okay, and then secondly, the thyroiditis. Okay, this is the inflammation of gland that cause swelling on the thyroid, either by the attack of bacteria or virus or injury. Okay, that cause this, and then it will sometimes influence okay the release of hormone on thyroid. It will lead to either hypo or hyper. Okay, and then the third reason, okay, a non-functioning thyroid gland or either because of the attack of our immune system or genetically okay having some problem, and then the release of hormone cannot be in a proper way, that will cause all this thyroid problem. And then finally uh, those release of hormones are done by our hypothalamus and then our pituitary gland. It will affect the release of thyroid hormone also, because the instruction given by this upper gland will affect all the lower gland activity. And so if you are having okay like those emotional problem, it will affect the hypothalamus, and then hypothalamus will give a wrong instruction to your pituitary gland to release okay the stimulating this hormone to the what we call the thyroid gland, and finally it causes our thyroid gland to become imbalanced. This is a diagram showing how the hormone is working inside the body when we talk about thyroid problem. Okay, so you can see from here the hypothalamus is releasing uh, some hormones to instruct the pituitary gland okay to release okay some of the different types of what we call the stimulating hormone okay to instruct okay further the thyroid gland to release T3 T4 all those thyroid hormones okay, so that finally it will affect all the organs and then the metabolism inside the body. And in this process you will see okay there will be communication between the thyroid okay and then the organs, giving information back to our pituitary gland okay, and then sometimes it will go back to our brain also, or some emotional effect will happen, and then this will further having a reaction from the brain, and then to instruct the body to uh, enter into a further action. That's why you can see from here the hormone imbalance it will eventually affect some of the absorption of minerals and so on. So it will lead to endocrine disorder. Okay, the release of hormone will get imbalance, and finally it affect the nervous system disorder too. And then these two systems are the basic communicating agent in the body. They are connected to the other system inside the body. So if they got into disorder, that means the transmitting of information from your brain to the whole body, to the cells, to the organs, and then to the other system will get into trouble, and then it will mess up all the function, and then other system of the human body cannot complete their operation without a very clear and sharp communication among them. And then finally it will affect your inner doctor, because your inner doctor are made up by all these system. Then your system cannot work well, and then you will go into all kinds of problem, and then it starts begin to have all kinds of illness. Hormone imbalance finally will cause a menstrual problem. Normally, most of the women, okay, they will experience many types of different this menstrual problem. There are basically three kind of period problems they might happen. Okay, number one, normally women will experience this what we call the medical terms of amenorrhea. Okay, amenorrhea. Okay, the absence of a menstrual period in a woman of reproductive age. That means when it's supposed to have menstrual cycle or when it's still young, okay, but finally it stop, okay, in a sudden, or sometimes it might be very irregularly, okay, to have this menstrual period problems. uh, that is what we conclude on. They are having this amenorrhea, okay, problems. And then secondly, they might have this what we call the very difficult to pronounce this mensnoria, okay, painful period. Okay, layman, we are talking about a painful period, okay, including severe cramps, or when these period times, they will experience very often the cramp is happening, and then it's very painful sometimes, or even cannot work somehow, until very seriously affected emotionally. And then some might have sometimes fainted because of all this pain. And then scientists already proved that the pain is really very painful one. Okay, it's not what men always thought that, especially the boss, or when the staff are applying a leave because of period cycle, they will thought that the staff is cheating or something like that. But scientists already proved that if they are really having this period pain, it's very very painful one. Okay, and then finally there is an abnormal this uterine bleeding. Okay, means Virginia bleeding after sometimes having sex, or sometimes without any reason. Okay, their bleeding is happening. Okay, these are the three types of common woman this period problems they are facing. In order to understand why they are suffering from these three types of period problems, we should understand basically some of the hormone that release under the female gonadal gland. Okay, there are basically three big hormones. We call the androgen, estrogen, and progesterone. Okay, and then both men and women produce androgen and estrogen in their bodies as uh, not as what we thought only women have this estrogen. Okay, men actually also have one, but different ratio, okay, of the release of this hormone. And then mostly all the period pains and then all the period problems are caused by the release imbalance of the release of this all these hormones inside the body. So this is what happened inside the body in terms of period cycle. Okay, there is basically communication within the this gonal gland, all the sex organs. For example, like women, we have Virginia. Okay, and then they release different types of hormones to communicate with the brain. Okay, so the brain will hypothalamus, hypothalamus will instruct her pituitary gland, and then pituitary gland will further instruct your thyroid gland, and then your adrenal gland. All this, it will affect finally the sex hormone, okay, which we call the androgen, estrogen, progesterone in the body also, and then it slowly the formation of the period cycle will happen, and then the communication will be from the vagina. They will send some signal, okay, to your thyroid, to your what we call the pituitary gland, and then to your hypothalamus. Okay, so they are interrelated, and then they will be affected. For example, during period, you are emotionally become weak, or sometimes we get anger very fast because of all this hormone communication inside the body. Or sometimes if you have depression or those kind of problem, you might affect your period also. Okay, so they are interrelated, then they affect each other or in different way. As a lady, okay, this is your responsibility, okay, to understand your hormonal changes in human menstrual cycle, so that you understand what is happening in your body or during your menstrual cycle. Okay, so from here we can see actually a complete menstrual cycle would take if accurate calculation will be 28 days, and not what you all the while you thought of a 30 day 1 month. uh, Actually, if we want to calculate in a very accurate manner, is 28 days. But sometimes it's not easy to maintain in a very accurate, okay, condition. So we will take into consideration plus and minus an extra 3 days. That means maybe 25 days and 31 days is still considered normal, okay, in a menstrual cycle. Okay, so when it start, let's say on the first it start to go into a menstrual cycle. That means the bleeding is start coming in. So the period times normally it would take 3 to 7 days, okay, to finish. Okay, so if a strong and very stable women, okay, they might take exactly 5 days, 3 days higher in volume, okay, in the bleeding, and then 2 days slowly goes down, and then on the 6 days it will finish. Okay, but somehow it's quite plus and minus 2 days. That means 3 days and 7 days we can go, and then it's still consider your period times is still common, okay, it's still normal. So if beyond, okay, this, let's say you take only 2 days, okay, you already stop the period already, or go after 8 days, or even sometimes 10 days, then that is too long, and then there is the delay, and then drag of times, and normally is due to some problem on the hormone release, and then some of the maybe her blood circulation problem. Okay, it might happen in that way. So in order to know whether you have imbalance of hormones, so you can refer to the times that you take to have this period, okay, the period times okay. So 3 to 7 days, okay, is the limit, and then beyond that it's consider something happening, and then normally it's because of imbalance of hormone is started to happen in the body. But using this method sometimes it will be too late, because normally if your menstrual cycle also be affected, that means the body hormone imbalance is actually quite serious already. So for those earlier detection, you have to refer to all those symptoms that I already mentioned earlier, like for those hypo that will show in the skin, in the hair, okay, all these symptoms, or in your energy level of the body, then you might be able to know, okay, that your body is already in the condition of hormone imbalance. Okay, so after the complete of your period cycle, then the body will go into the second phase, what we call the follicular phase. That is the making of the eggs inside the ovary there. Okay, so this might take a few days to run. So ovulation period is about 14 days before the next menstrual periods. Okay, menstrual period will be after another 28 days. That means 14 days before that. That means on the 14 days of after the beginning of current period times. Okay, after 14 days, okay, is the exactly okay when is supposed to have this ovulation. That means the matured eggs are discharged from the ovary, and they are a certain amount of estrogen and this androgen. Okay, within a day or 2 day after, the level of these two hormones begin to decline again. Okay, during ovulation, it may cause abdominal pain and mild irritability, even a small amount of bleeding. So that's why sometimes after finish your period, okay, and then you wait after maybe another week, okay, or another 4 5 days, you happen to have okay some bleeding again, then you will thought your period is not finished yet, but actually it's not. Okay, is the matured of the eggs inside the ovary there, and then this the discharge of the eggs, then it will cause okay sometime having a mild amount of bleeding will happen, okay, during this period. Okay, and then on the 14 days and plus and minus of 4 days, okay, that means on the 10 days after the current period, okay, the beginning of the current period, okay, or 15 days, okay, after the current periods, during in between these 8 days are the most easier to get this pregnant one, okay, what we call the fertility period. Okay, so uh, the body the what we call the estrogen progesterone will start to begin to release also, so to prepare for the formation of the endometrium. Okay, that means the inner lining of the vagina will get thicker. The rich and firm endometrium determines the implantation rate of your matured eggs. Okay, so sexual desire decrease and suddenly becomes uh, what we call coquettish. Okay, very difficult to pronounce also this word. Okay, that means your character will slightly changing. You rely more, then you becomes more women, okay, during this period. And then of course before this, the period where you will get into pregnant very easily, the fertility period, your sex desire will increase them tremendously. And then the change in hormone will begin to start. And after the 8 days, okay, and then finally the 19 days or 20 days, then this is the time, okay, the progesterone will get higher and higher, so that to make sure the thickening of the inner lining of your vagina, okay, what we call the formation of the endometrium, okay, will begin, so as to get ready for the what we call the implantation of the joining of the sperm and the eggs is happening inside the body. Okay, so during these periods, okay, the release of progesterone will be higher and higher. If finally you didn't get pregnant or don't have any sexual activity, and then the body will get into the last week, okay, into the last 7 days of the period cycle, that the progesterone will keep on release, and then the body will do a change, okay, in the reaction. Okay, it will concentrate, or it will divert all a lot of blood to your vagina, okay, so as to make sure the thickening of your vagina, okay, the formation of the endometrium will get thicker and thicker, and then those waste that are supposed to be discharged out will concentrate on the vagina there, and then sometimes you will instruct the all the body vessel, okay, all the blood vessel to okay expand and contract uh, in a very strong manner, and then this is the time, okay, why we will experience some discomfort, okay, due when the period is almost already to coming, okay, and then you might feel uncomfortable, sometimes even maybe some of the blood vessel in your brain or in your spine, okay, may be affected also, and then it will cause pain, you might experience headache, okay, experience this back pain, okay, because of this the progesterone level reach its peak in the fourth week, so and the endometrium begin to wither and was about to fall off, so hormonal turbulence make us emotional, okay, so this period ladies will get angry very fast, and then you'll get tired very fast also, lack of concentration, and then your breast is swelling, like to eating and chewing a lot of things, then you tend to eat a lot of things during this period. This period is craving for sex, okay, so before the period so the ladies will craving for sex. This is caused by stress, caused by premenstrual irritability and pelvic congestion, okay, so this is happening before the period is happening. So finally, okay, until the 7 days is reaching the 28, and then the 29 days it begin another cycle of periods again. So from here you can see why it happens, all the pain, then the emotional changes in the body, because of all these change in the hormone, okay, and then sometimes the hormones might not be released, okay, to the bloodstream or in according to the cycle or in a proper way, then it causes a lot of what we call the delay, or what we call sometimes all those instructions is not clear, then the clamping of the muscle, okay, and then you have a period pain, and then you have headache, back pain, all these problems, okay. There is how it happens, and then hopefully, okay, by knowing this then you should be able to know better on how your menstrual cycle is happening, and then what is the period that you must really take care, okay, when you are having sexual activity, then you will get pregnant very easily, then you have to take precaution action, okay, before having sex, okay. When we talk about serious period pain, these are the two hormones that are related to this, what we call the prostaglandin and the what we call the interleukin. These two hormones are released by your sex organs, and then it causes the contraction and then the spasm of the uterine smooth muscle, which lead to the decrease of uterine blood flow, and at the same time it also increase the sensitivity of the peripheral nerves to pain, and finally produce what we call the period pain, or medical term we call the dysmenorrhea, okay, very difficult to pronounce. Okay, so this is the two hormone relax release by the sex organs, okay, during your period cycles, which affect and then cause the muscle to react on it, and then finally it cause the period pain. So in order to control the period pain, okay, we have to control this release of this type of hormone during the period cycle, to reduce it, okay, so that the contraction and then on the muscle on the over this vagina there is not that high, okay, and then the pain will be reduced to the minimum. These are the factors that cause period pain or period problem lah, period problem. Firstly, because of this blood circulation is not that good. Okay, so normally we will advise ladies don't take too much of cold things like cold water, and then try to avoid in environment which is low in temperature. Okay, and then try to do more exercise, and then rest properly, okay, because insufficient sleep might affect the release of all the hormones inside the body also, and then the low level of energy inside the body, and then it causes a low level of this temperature, okay, and then finally it will lead to the viscosity of the blood begin to deteriorate, and they make the blood flow become very slow, and then it affect the blood circulation. Okay, so second factors, the BMI. Okay, if the BMI is too low, that means you are too thin, then you might have a problem on this hormone, because you might have a lack of material to build all the hormones, okay, because of getting too thin. Just eat more and then get back a little bit of your weight, okay, you might improve it. And then maybe you will have this of course, just now we already mentioned the imbalance of periods due to the higher endocrine all the endocrines on the higher gland, okay, like pituitary, your pineal gland, your thyroid gland. All these will affect the release, okay, of all the hormones by your sexual organs also. And then genetic problems, okay, might affect you, okay. Let's say for example your mother have this problem, then you might have genetically having this problem also on the function of the release of all the hormones by your gland also. And then it might also be causing by other woman diseases, okay, for example like the what we call layman, we call the inner lining uh, the the placement of this uh, and what we call okay, just now we mentioned about it okay, let me have a look. Okay, the inner lining is supposed to be flushed out, okay, when you are having a period, okay, so that it will cleanse, and then you will go into another cycle. So the thickening of the inner lining, and then the discharge of all these things, okay, outside during the period, okay, is not clean enough. Okay, so some of the tissue, okay, of the inner lining might attach to certain let's say the tube from where the ovary is start to go into the your vagina, okay. So the tube there, maybe sometimes the tissue might attach on that, or okay, it might happen on the side of the vagina, or on the uh, front part of the vagina. So when it happens on the second round of period cycle, when if there is any joining of this sperm and eggs start to happen inside the body after having sex activity, and then these things will settle down or attach sometimes incorrectly or on the different position or out of the vagina, either on the tube there, because they have wrongly recognized the inner lining, those didn't discharge out properly one that attached on this area. They thought this is the place they are supposed, okay, to settle down, okay, to have further her development on the eggs, okay, and then becomes a baby, and then this will cause problem on the pregnancy, and then the growth of the baby eventually will uh, give a lot of problem, okay, to the mother on the pregnancy, and then eventually maybe it cannot uh, the baby cannot grow properly nicely, and then it will discharge out, okay, halfway, okay. And then secondly, maybe you are having uh, some illness of growing some seeds, or maybe how you are having tumor, okay, all kinds of tumor, okay, that affect the flowing and discharge of your periods, and then it causes all kinds of period problem. And then maybe inflammation is happening on the front part of the vagina, okay, where inflammation, and then it causes the flow of the periods is not very smooth, and then eventually it causes many types of pain or period problems. You can see clearly from the explanation earlier I've gone through. So the effect, the causes of endocrine disorder actually is from environment factor, physiological factors, or emotional factors, and nutritional factors. Okay, environment factors mainly change of temperature, okay, climate change, and then sometimes the pollution of air, all these things. Okay, and then physiological factors maybe because of your gender, okay, female, male, okay, and then your age, okay, and then some of the bad habit that you are having, like you didn't sleep nicely, then change, okay, the release of hormones inside the body. And then third, emotional factors, like you are having depression, anxiety, all these emotional problems, or it might affect your sleeping patterns, and then finally it affects the endocrine system to run smoothly also. And then finally the nutritional factors, okay, lack of certain nutrition, okay, like tryptophan, you cannot sleep nicely, then how it affect, okay, the performance of your endocrine system. And then sometimes essential fatty acid, okay, essential amino acid that are required in the formation of all the hormones. If you didn't take from foods, okay, then you might have lack of material to build to make all these hormones, and then it will cause finally cause all the endocrine system to become in disorder. In order to regulate and balance the hormone release in the brain, Ventos Chilling Ministry recommend the use of IM laser together with CVA. So how IM laser can help in the process of balancing the hormone release in the brain? First of all, I'm not going to go into too detail on the function of IM laser because you can refer to my earlier video which are talking about IM laser alone, where you can go into further details on how it functions and how IM laser help the bodies. Here I just roughly let you know, after using IM laser, it can improve the blood viscosity and promote a better blood circulation because the photon provided by IM laser will be able to give a very good activating effect on all the enzyme activity inside the body, and it helps to cleanse all the blood cells and make the blood cell won't attach together and flow very
smoothly, so that it can carry oxygen and distributing all the nutrients inside the bloodstream there effectively. So with a very good blood circulation, all the uh, photon, okay, the nutrients and oxygen can be delivered to all the cells in the body effectively. And then the light and the photon, when it reach the cells, so it will activate this enzyme in the mitochondria. We call it oxidase C to promote, okay, the making of energy in the mitochondria. The ATP will be released after the process of biostimulation by the photon. uh, ATP will be released and the cells will be more energetic, having more energy, and then this indirectly will promote the function of all the cells and the organs as well. So in the long run, using IM laser, long-term improvement of brain function will be activated, and then the brain will be healthier and more energetic to produce and to carry out the function that is supposed to do. That is to release different types of hormones in the body. And then in that case, the growth hormone and the melatonin can be effectively secreted and produce a very good sleeping effect. Besides that, this hypothalamus will release all kinds of happy hormones like endorphin, dopamine, serotonin, and oxytocin in the brain also. And so all these very comfortable and then relaxing hormones will make you feel happy and calm, uh, and then easily you can go into a very relaxed condition, so that it eventually give you a very good quality good sleep. And it improve the coordination among various body system too, through the strengthening of the neural function. So the neural are made up of cells also. So the improvement on the cells energy will improve the neuron function, and then there's transmitting of signal in the nervous system can be uh, improved and enhanced. So the connection and then the coordination among all the various type of system in the body can be communicate, can be carried out more effectively. So finally, it will give a very good result in balancing and regulate the function of endocrine system. However, the use of CVA will help to provide full nutrient to the body, because CVA contain uh, the complete essential amino acid, complete essential fatty acid, full range of minerals and trace minerals, and full range of vitamins that the body required. And then CVA also provide tryptophan and serotonin to help to promote a quality sleep as well. And then the ginseng monoxide in the CVA can effectively promote the stability of the neural system and the balance of the secretion of hormones in the whole system. And then the super antioxidant substances contained in CVA, okay, with the combination of wild ginseng and then this Sipaton, aronia fruits, and then promulgated fruits. Okay, all contain very high concentrated antioxidant It plays a decisive role in the protection of our cells and especially our gland cells. So it makes sure the gland can function properly, the cells function can be carried out effectively. And then high content of minerals and all the vitamins are effectively stabilize the nervous system in the body. So once the nervous system is function uh, in a very stable way, it can connect all various system inside the body so that the complete body system can work in a very stable and very smooth way, and then the balance of the hormones release can be achieved.
To balance the hormone system, first of all, we must have a very good quality sleep, because the upper gland, like your pineal gland and your pituitary gland, the release of all these hormones will affect on your thyroid gland, and then on the adrenal gland, and then your sex organs also. So it's very important if you want to monitor and then balancing the whole system. We have to have a very good quality sleep first.
You need to take more high tryptophan food in order to promote a better sleep, because these are the basic ingredient which will form the melatonin in the pineal gland. The food that increase serotonin are the tryptophan plus carbohydrates, and then serotonin will be further converted into melatonin inside the by the pineal gland. So these are the food that contain very high tryptophan. For example, like eggs, milk, banana, or in potato, and then in some, especially spirulina. Okay, you can consider to get more supplement of spirulina, so that your sleep will be better, because these are the uh, raw basic ingredient that we need to form the melatonin. So for your information, our product, the CV8, will have this essential amino acid tryptophan in a quite a good quantity, and then that's why it can promote a very good sound sleep after taking the CV8. And then in CBA also contain certain types of ginseng monoxide, which can calm down, and then will give a very good effect on the nervous system, the neuron of this whole body to calm down. So it give a very good good sleep effect on the use of CBA actually. Finally, practice good habit to promote the release of all these happy hormones inside your body. For example, like endorphin, it can be created after exercise. So some people are crazy of exercise because they are too used to have the endorphin in the brain day after exercise. And then laughing will create endorphin also. So if you can keep a very good smile or laughing all the times in your daily activity, you should be able to release more endorphin in the brain to make you more happy and enjoy life. So secondly, the dopamine. Dopamine will be released if you can do something good, contributing to others, and make you feel proud. Okay, will make the secretion of dopamine in the brain there. So serotonin is a very important hormones that normally depression people, they are lack of this hormone. And serotonin uh, actually will be able to release when you have the ability to what we call uh, benefit others. Okay, and then we able to give the body will secrete serotonin, and that cause a sense of happiness. Finally, is the oxytocin. Oxytocin will be released when we give a big hug to your family members, okay, to your lover, okay, husband and wife, and then maybe you practice give some courage to your neighbor, your friends, okay, by giving a big hug. They will feel better and feel calm down because of the release of this oxytocin in the brain there. So by practicing all these good habits, uh, try to let the brain get used to release this kind of happy hormones in the body. Then you will be able to relax and calm down yourself, and have a better control of the nervous system, and then the release of all types of hormones to be in a more balanced way.
For those you are having like hyperthyroidism, or when the hormone release or become hyper inside the body, we would like to advise you, okay, to combine some of this practice together with the use of arm laser. It will be double up the benefit of arm laser. Okay, that is normally before you sleep, or maybe you can practice or some breathing technique. Okay, these all techniques to relax yourself, and then to make you to be more calm, and then easier to sleep, okay, to promote a better sleep. Okay, so from here, using learning the technique of breathing, okay, and then do some meditation, okay, before you go to sleep, or inhale and exhale more, okay, by having a longer exhale, normally it will make you relax better in your body, okay. And then before that, before you sleep, maybe you can practice doing some of the exercise that shows here. Or if you don't want to go for too heavy exercise, okay, before you sleep, then maybe you can try that simple exercise that I will show you later on. These are some of the exercise that you can practice before you go to sleep, okay, so as to, okay, relax down your body, and then through all the breathing technique, okay, you can calm down your brain. So the point toe flex toes exercise before you sleep, and then go for some basic stretch, okay, on your leg muscle or inner thigh, okay, so that to give a contraction on the muscle, and then a relaxation, okay, of the muscle, so that eventually the muscle will get relaxed, and relax, further relax. And then finally, okay, maybe you can do a V support, what we call the V support, whereby you make use of your core center, okay, use a lot of strength on your abdominal, okay, and then stay there and hold there for a period of time until you cannot stand, and then you release it down. Then you get feel the relaxation that is happening inside your body during that time, okay. And then sometimes you might go into sleep after this exercise. Then you just get a better sleep, okay, because of that, because the muscle relaxation of your muscle will lead to the neurotransmission to your brain, and then slowly the activity of your nervous system will get lesser in your brain, and then slowly the whole body will calm down, and then will get more relaxed, and you will improve your quality of sleep, okay, in the latest. Combining the use of arm laser with all the exercise. So normally I will encourage, before you go to sleep, okay, you at the bed there, okay, you start using your arm laser at the back here, the 风池穴 and then maybe your 太阳穴, okay, and then these two part you can do some target treatment on these two parts, or maybe for 15 minutes, okay, because this 风池穴 is a very good point to lower down your high blood pressure also. And then you might uh, massage a bit on the forehead here, because this is the part normally when you have stress, you are under pressure, these are the places you will accumulate all the stress, and then the muscle here will get tension, and then by releasing by massage a bit here, you can relax your brain your head very fast in a very fast moment. Okay, and then during this process you can do some breathing technique. Okay, breathe, inhale, exhale and then make your exhale longer, so that your body will go into a relaxed mode more easier. Okay, if you do that after the first 15 minutes, or sometimes if you want you can do 30 minutes also, then you shift your eye laser to your head, top of the head. Okay, we call the 百会穴 there. And then the line you put on the rubber cap. Okay, and then you put on your forehead there. Okay, we call the 印堂穴 there. These are the two parts. Okay, we want to regulate the qi inside the brain here. Okay, so that and then there is a small hole somewhere here, so that the light can go in and then stimulate the function of your pineal gland. Okay, so to stimulate the release of your making of your melatonin to be more active, and a higher release of melatonin, which will promote a better sleep in your body. And then in this process, maybe those happy hormone will be released in the brain, and then you will feel more comfortable and more relaxed. And then during this time, maybe you will slowly go into sleep. Then you just uh, leave the things, leave it stop automatically, and then it will promote a better and healthier and soundly a good sleep for you. And then the begin of your restoration of the body will begin when you have a very good deep sleep during the night. So for those who are having hormone release or become too low, or become hypo, okay, like hypothyroidism, okay, you maybe how you will experience symptoms like fatigue, no energy, okay, and then uh, uh, change of mood, okay, and then you don't depression will happen. Then when you use eye laser, I will encourage you to do some cardio exercise, especially in the morning. Okay, you can go for a strength training. Okay, even though it's quite difficult for those who are having depression, maybe you don't want to go for exercise. Maybe at least you are having your eye laser and then you go for a walk, okay, in the garden to really increase the formation of energy inside the cells with the help of eye laser. Okay, because the light will stimulate some of the enzyme activity in your mitochondria, so as to promote the making of your ATP inside the body, so that slowly you will get your gland to be repair restore, okay, in the function. And then you can do some target treatment also. Maybe if you have hypothyroidism, you can directly put your eye laser on your thyroid gland. Okay, this on the front of your neck. Okay, and then maybe you can apply some of the point also, if you want to do. Okay, I will encourage you to stimulating your pituitary gland also. Okay, there's putting at the back, okay, on your head. Okay, there is opposite on the way of stimulating the pineal gland. Stimulating the pineal gland, normally we put uh, on the middle of your two what we call the eyeball there. Okay, this will go to the back. Okay, and then you put at the back. Okay, okay, so this here hopefully and then another the watch you put on the top of the head, so to stimulate to give more light so as to help the pituitary gland to function more actively also. Okay, and then maybe you can put at the back, okay, of your stomach, okay, to improve your digestion, and then to improve the meridian of what we call the kidney and then the gallbladder, the bladder meridian point. Okay, it will join with the brain here, so to push the qi in this meridian, okay, so that it will run better. And then maybe you can go for this san yin jiao. Okay, this is the point where you can what we call improve the circulation of this liver, uh, spleen, and then the kidney meridian they are from your leg. Okay, then you can improve that these three meridian, then eventually it will help, okay, in the gland function, so all the gland will be more actively involved in the production of all the hormones. Okay, period problems. When we use time laser, the places that we are using, okay, if we want to go for target treatment beside the standard treatment that is on the wrist and on the nose, beside that you can go for target treatment also. So these are the point that you can do, okay, at the back, okay, almost the end of your spine, okay, you can put the device here to give some light so that it will eventually reach your pelvic, and then in front, around 3 fingers or down of your this belly button, okay, you can put your arm laser here, okay, so to activate the qi hai meridian point here. Okay, it will help in reducing the pain, okay, and then the menstrual cycle to be in order. And beside that, okay, you can also use the line, okay, to activate this point, we call the tai chung shui. This is very important point for the liver meridian, okay, and then it will help to release the all the some of the qi let's say you get anger, okay, 生气 what we call and then you feel unhappy, and then you want to release all this qi, then you can put the line here, okay, to activate this tai chung shui, or there is between the thumb, okay, the first thing the from your leg the first and the second joining part okay, the deep second stage phase of joining part, there's the tai chung shui. You can activate this meridian point. And then the san yin jiao, just now I already mentioned, there's around 4 finger, okay, above the ankle here, okay, you're on your leg, okay, 4 finger up here, okay, you can activate this point also. And then if you are free, sometimes you can activate your he gu shui, that is between the on your thumb and then the second fingers, and then the end of it, when you press it, you feel a little bit pain, okay, sometimes numbness will happen also. You can always try this point. These are the point which control, which will reduce pain, okay, the reaction of pain or the sensitivity of the pain will goes down if you press on this point, the he gu shui. So you can use arm laser to point on it also, or maybe sometimes you can use your finger to press on it, okay, it will give you a very good result also, especially those who have gastric problem, they are having gastric pain, okay, it can relieve also. So beside, okay, using arm laser and CV8 to provide you full nutrient, you are encouraged to change a little bit on your meal also, okay, so that your 3 meals will include all these things the coconut oil, okay, and then some what we call the nuts, okay, all types of nuts, sunflower nuts or Brazil nut, okay, or what we call the cashew nut, okay, all these nuts will help a lot in the formation of the hormones that require all the essential fatty acid, okay, but actually in our civic egg, okay, because of the sipaton, okay, the use of sipaton, it will contain all these essential fatty acid also. So you can take a look on this. If you are having a hypo, okay, the restriction, the increase of iodine intake, you need to be more, so you take some seafood things, okay, like fish, okay, like those shellfish, all these products, okay, that you can take more, okay, you are experience hypo, okay. However, those are having hyper one, then you have to cut down, have to be a bit careful on the intake of all these seafood products, okay. Take more fruit juice, okay, vegetable, and then a lot of nuts, okay. And then for those hypo one, you might take seaweed, all those things, okay, all from sea one, it contains a higher level of iodine inside. So those who are having hypothyroidism, okay, some of the vegetable and then fruits, or you might be careful also. Okay, you shouldn't take too much of like cauliflower, okay, and then sweet potatoes, okay, peanuts and garbage and spinach, okay, because your metabolic is not that strong, and then the digestion system is not that good. So some of this, okay, may contain very high carbo. Some of it may contain certain type of protein which are quite difficult to digest, and then maybe having too high of this what we call iron, and then some of the vitamin B, okay, you might difficult to what we call digest, or your, because of your metabolic problem. You should be away, and then don't take too much of this type of veggie, okay, in your daily meal. Remind you again, for those who are having hyperthyroidism, okay, to avoid iodine and zinc rich foods such as shellfish, oysters, seaweed, eggs, and Brazil nuts, and etc. Or artificial sweeteners like stevia or sugar free, okay. Normally those who are having a diabetic, normally they will practice all these artificial sweetener, and then this is not good for those who are having hyperthyroidism, okay. Milk and milk products like yogurt, ice cream, etc., or alcohol and erected her drinks. Avoid her drinking beer and soft drinks also, okay. And packaged or artificially flavor and color foods, all these are not so good for hyperthyroidism. You should avoid or take more natural foods.
Briefly summarize the miracle power of IM laser, CV8, and CMC serums. When they work together, they will make sure you have a very good blood circulation, because it improves the blood viscosity, and then to let the body to get more oxygen and nutrient transport to all the cells in the body. So it improves the gland function by providing a very strong antioxidant, not only from CV8, but also the use of IM laser. It will create nitric oxide, which is a very good antioxidant property also, and then it is effective in cleansing the blood vessel, and cleanse all the red blood cells to make a very good blood circulation too. So it would be able to promote the stability of the nervous system, because of the minerals that contain, and then the trace mineral, which are the very important signaling agent or in the process of nervous system. And then finally it complete because the complete nutrient and the function of IM laser, which repair uh, and restore and regenerate new cells and promote good sleep. Eventually it balance up the whole system inside the body, and then the body will be in the state to promote a better effect in the creation of external beauty. So it give an amazing beauty effect. Okay, after using for a certain period, you might be look younger 5 or 10 years, or some even after maybe 1 or 2 years of using, they will look maybe 10 or 15 years younger. So it of course it will eventually enhance and our energy level and then our vitality. So the whole uh, use of the this package will provide a very high antioxidant and anti-cancer effect. So the use of a Ventrose Youth Restoration Package will regaining your youth, and then to create a brand new you from the inner health to external appearance, external beauty, to regain how youthfulness is no longer a dream.